Hi, my name's Brian. I've had a career as a dental technician for the past 38 years. This research has been compiled over the last 20 years. I've presented the facts of my research to the universities of British Columbia. Unfortunately, I don't have millions of dollars for them to verify or accredit my hypothesis. So for me, not to release information that I believe to be true is wrong. And knowing the lack of prevention available in the field of balding today, I've decided to produce this video.
Hair structure. Hair is composed of strong structural protein called keratin. This is the same kind of protein that makes up fingernails and the outer layer of skin. Each strand of hair consists of 3 layers. 1. The innermost layer, or the medulla, which is only present in large, thick hair. 2. The middle layer, also known as the cortex. The cortex provides strength as well as the color and texture of the hair. 3. The outermost layer is known as the cuticle. The cuticle is thin and colorless and the protector of the cortex. Hair follicles grow in repeated cycles. One cycle can be broken down into 3 phases. 1. The anagen phase. 85% of all hair are in the anagen growth phase. At any given time, this phase lasts between 2 to 6 years. Hair growth is 10 centimeters a year. 2. The catagen phase. This transitional phase lasts about 1 to 2 weeks. The hair follicle shrinks to 1/6 of its normal length. The lower part is destroyed and the dermal papilla breaks away and rests below. 3. The telogen phase. This is the resting phase that lasts 5 to 6 weeks. During this time, the hair does not grow but stays attached to the follicle, while the dermal papilla stays in the resting phase below. 10 to 15% of all hair are in this phase at one time. At the end of the telogen phase, the hair follicle re-enters the anagen phase and the cycle begins again. The dermal papilla and the base of the follicle rejoin together. If there is a blood supply still connected, a new hair begins to form. If the old hair has not shed yet, the new hair will push the old one out and visible growth starts again.
This is key information, and it gives the young individual who is worried about balding some control over their life situation.
Human hair grows everywhere except on our palms, soles of the feet, and the eyelids apart from the lashes. Vascular activity feeds these unhaired portions of the skin, unlike the hair follicles of the head, which have their own arterial blood supply designated directly from the superficial and occipital portions of the superficial temporal artery. We know exercise stimulates blood flow. This nutrient-rich blood nourishes each hair follicle, promoting healthy hair growth. Lack of this sufficient blood flow would yield the growth of duller, more brittle hair, and then lead to balding. Unfortunately, some exercise can inhibit blood flow in certain areas, such as lifting heavy weights, i.e. bench press curls. Most commonly when this exercise is performed, the teeth are clenched together. This causes those people with a Class 2 skeletal jaw relationship to reinforce this position more firmly. The distal or backward movement of the jaw that is caused by the Class 2 relationship causes the condyle to occlude the superficial temporal artery against the base of the skull, blocking the blood supply to the vertex of the head. The occipital portion of the superficial temporal artery is not affected by the occlusion because it splits away from the trunk portion of the carotid artery before or earlier than the parietal and frontal portions, which pass directly between the condyle and the base of the skull. Baldness is caused by the body's failure to produce new hair, not excessive hair loss. Testosterone plays no role in baldness. Blood supply plays in to be a significant factor when the only communication or connection to the body is the blood supply in and out.
Yes, if you are diagnosed with skeletal class 2 jaw relationship, you will go bald. But there are orthodontic solutions and sometimes even simpler dental solutions to prevent the balding and the skeletal class 2 if recognized early enough.
Occlusal facts. Occlusal relationships of your teeth and how they affect skeletal relationships of your mandible. Occlusal relationships are measured in classes 1, 2, and 3, each of them having their own subcategories which are vulnerable to change at any time when teeth are lost or change position. Class 1 occlusion is the average norm. Class 2 is when the teeth on the lower arch line up back a step. Class 3 is when the teeth on the lower are forward a step compared to the upper. All of these classifications have varying degrees from mild to extreme. Usually, if you are Dental Class 1, you are Skeletal Class 1. If you are Dental Class 2, you are Skeletal Class 2. If you are Dental Class 3, you are Skeletal Class 3. In this research, we uncovered 2 Class 1 dental cases that are actually Class 2 skeletal. We uncovered a pseudo-Class 3 that was actually a Class 2 skeletal. So at this point, there are too many combinations of teeth versus jaw for that to be 100% true, but often this is the case. A Ceph X-ray is the only 100% foolproof way to determine skeletal relations.
Skeletal Class 2 must be corrected early. So how do you know if you have it or not?
Skeletal measurements are categorized in class as well. Skeletal Class 1 is when the distance between the eminence of the head of the condyle and the base of the skull in the glenoid fossa is 3 millimeters. Skeletal Class 2 is when the eminence of the head of the condyle and the base of the skull in the glenoid fossa to be less than 2.5 millimeters. Skeletal Class 3 is when the distance between the eminence of the head of the condyle and the base of the skull in the glenoid fossa exceeds 3 millimeters. Again, all of the skeletal classes have different degrees and divisions from mild to extreme. To examine the true relationship between your jaw and your skull, you must get a cephalometric X-ray taken because the soft tissue of the face is able to mask itself to normal appearance. Mainly because your teeth are apart 23 hours of the day, which allows your soft tissue to have a somewhat more relaxed look, masking the facts. If you are having a hard time with understanding the skeletal classes, I will simplify it a little. Jay Leno's skeletal profile is Class 3. David Letterman is Class 2 skeletal. Maybe now you get a better idea of jaw position. Not only that, but we can compare hairlines. Jay and David are both living examples of the jaw doing the polar opposite. Jay's jaw is in traction and David's is in retraction. David's jaw goes back and cuts off the superficial temporal artery, and Jay's jaw projects forward, moving the mandible condyle and all forward, away from the skull, leaving the superficial temporal artery lots of room to flow. As for true Class 1s, there are about 1% of the population this way. Lucky people.
I'm hoping this is a more direct approach to communicating to those worried about balding. Male, female, rich, poor.
What this research boils down to is, if you are male and Class 2 skeletal, you will go bald as early as 16. The good news is, it can be detected and resolved as early as 8 with one simple X-ray and analysis. We recommend the earlier the better, and if interceptive treatment is needed, it is important to get on it. You must be vigilant in correcting the Class 2 skeletal. Get it in writing from your dentist, stating, yes, we will treat and correct the Class 2 skeletal. Now for women, I believe the same is true, even though female-type balding most of the time is thinning. It is still thinning of the vertex, same area as the male disorder, just not as completely bald most of the time. I have observed men with female-type balding. To me, it means only a partial occlusion blockage of the superficial temporal artery. Get a Ceph X-ray analysis. They are inexpensive and should really be mandatory at the loss of the first tooth around 8 years of age. Maybe this will change. There does not seem to be very much relative female anatomy available. Your dentist and your to-do list. Having said that, here is what you must do. Make an appointment with your dentist for your son and daughter to have a Ceph X-ray taken. Get the X-ray analyzed by an independent company such as Cephix. This is all they do, very cost-effective, under $50. This will take the burden off the dentist and place it on the company that analyzes the Ceph X-rays as a business. Next, if your dentist is not comfortable treating your Class 2 skeletal, he will know a dentist that will. Once you have found that dentist, you must get in writing that they will get rid of your Skeletal Class 2 and treatment will start immediately. Insist on that or find another dentist that will. The reason I advocate early treatment is because the life cycle of hair can last up to 6 years. But if there is no new hair pushing out the old hair, then the damage of the superficial temporal artery could have happened 6 years previous to going bald.